Hello, Stuttgart Military Community. My name is Colonel Jason Condrey, your Garrison Commander, and I appreciate you joining us tonight. Tonight's town hall is focused on resiliency and all the different tools and resources that we as a community have at our disposal to help deal with a lot of the stressors that many of us are seeing out there. So first of all, tonight we've got a little bit different format. I've got some experts in the room with me here. They're prepared to talk about resiliency, talk about resources. I've got many more that are participating from home. Some of them still in isolation or quarantine. And the intent is to give you as much information as you want or need and show you where you can look, whether it's the app or a web page, to get some additional information. So I'll start with a quick update, community update on COVID. Each of the people that's here with me tonight, they'll do a quick introduction and tell you why they're here tonight, and then we'll open up for questions. I do want to start first by saying that if you or someone close to you is in crisis, act right now. I want you to pick up the phone. I want you to make a phone call. Use that emergency button on the app. Call the MP desk. I don't want to wait for one more second than is necessary if you think that there's a problem out there that needs solution right now. So, first, COVID. I know that's continues to be the number one thing that everybody across the community is focused on. So I will tell you that we continue to creep toward the 100 mark when it comes to the number of positive cases within the community. However, I'm pleased that the number of people that are recovering is outpacing those that we find that are testing positive. In my mind, though, that reveals yet another problem. A problem that just as quickly can allow the virus to regain the upper hand, and that's complacency. And I'm talking about the kind of complacency that will cause someone to go out, place themselves at risk, or their families at risk, because they're not paying attention. They're not doing what we've been talking about for the last 3 weeks. The same kind of complacency that will allow you to have your kids go out and play with the neighbor's kids. Sure, it may not be on the playground, but they're not keeping their social distancing. The same kind of complacency that'll cause you to blow off one of the screeners, either at the gate or at the entrance to one of our critical services. It's that kind of complacency that I'm concerned about. As we fight COVID and we fight complacency, here's what you can expect from me. I'm not going to loosen up on the measures that we have in place. I'm going to continue to push hard. I'm going to continue to ensure that we are setting the terms for this fight with this virus. I'm asking that you understand. I realize there's lots of inconveniences out there because of the way we've arranged work, the way we've arranged access to services, and I promise you we are working ways to make that easier. And as we get that information, we get ways to do that. I'm going to let you know. I'm going to come up early and often and let you know how we're going to try and address that. And so I'll tell you right now, I appreciate all the ideas that you may see as criticism. I feel like it's constructive. It helps. It allows us to look in ways that we may not at some of the problems we're facing. And so we're going to develop some solutions. They're not going to be fast enough for some of you. I'm hopeful that they're fast enough for most of you. You've heard me say this, and I believe it's true. It's COVID day until it's not. But I am committed to ensuring that this community sets the terms for how we prosecute this fight. So for tonight's town hall, I've got some people in the room with me, and we're going to be focused on how to deal with the additional stress that this virus has created on us, in our homes, on our families back in the States, all the different ways that you're seeing it. The reality is that COVID is like Miracle Grow and rocket fuel for all of these little things that in the past kind of led up and built into some other sort of invisible or hidden threat. I've called these the insider threat in the past. And specifically, I'm talking about suicide. I'm talking about drug and alcohol, other substance abuse. I'm talking about domestic violence, domestic abuse. all of those things that tear us apart from the inside. And so we've got to figure out how to do this social distancing thing, because there's a very fine line between social distancing and those things that we need to do to keep us safe from this virus and social isolation. And we don't want to isolate. We need to find ways to connect. And there are lots of ways out there. And so that's what tonight is about. So with me tonight, I've got our Garrison chaplain, I've got mental health expert, I've got one of the teammates from our new parent support program, and our expert in the Army Emergency Relief Program. And so I'm going to let them talk to you briefly, and then again, we've got lots of people out there participating virtually. They're going to be answering your questions as you pop up, especially as we're not fast enough to get to them. And so with that, I'll pass it over to Mike to talk about some of the mental health resources.
Hello everybody, Major Oganovich. Good evening. So for me, this is a special day because this is, for me, my first day out of quarantine. And the last 2 weeks have been rough, and this is the first time in a long time that I felt that sense of isolation and anxiety. Actually reminded me of a long time ago when I was back at Fort Rucker, went through the SEER school and was the psychologist at the SEER school, and where I had to be a part of, felt that isolation, is also teach students how to deal with isolation. So any of those resources, I will happy to answer any questions related to those tonight. But there was also that sense of fear. I mean, the reason that behavioral health has been in quarantine for the last 2 weeks is because one of our own tested positive 2 weeks ago. And because of caution, we closed our doors and started working on how do we reach out to the community in a virtual way. So we spent the majority of our 2 weeks making sure that that capability is possible. Luckily, the person on our team that was COVID positive is almost completely recovered. She's feeling much better. So that sense of fear and anxiety about one of our own being sick, luckily went away. But I know there's many more people out there, as the Colonel mentioned, approaching 100 that are still dealing with that sense of worry and fear. So I can empathize with that. So just so everyone knows, starting Monday, behavioral health is going to open the doors again in a reduced capacity. Most of the appointments are going to be done virtually, probably starting off with the phone, hopefully moving towards video once the technology catches up with our willingness. But ultimately, I just want everyone out there to know that for everyone, resources will be available, either on post, off post, through the chaplain. We will be able to help you. Just ask, reach out, and we will get that done. Looking forward to answering any questions you may have. With that, I'll pass it over.
Hi, my name is Lisa Phelps. I'm one of the registered nurses at the New Parent Support Program. I'm also a mother of 4 and a military wife, so I understand the stress and the strain of all of that the COVID has brought to all of our families in Stuttgart. I am a member of a dynamic team of 3. We are 2 RNs and 1 clinical licensed social worker. We are actually doing our one-on-one care for you in the Stuttgart community through video calls, texting, emails, phone calls. And it is a no contact, but we are still reaching out to our families in need. We specialize in prenatal and postnatal care. We do breastfeeding, bottle feeding, solid feedings. We specialize in infant and toddler care. We do child development, but most of all, right now, it is about parents and being cooped up in a house with your partner and your children day in and day out, 24/7. It is a big job. A lot of us are taking on full-time parenting, full-time employee, and sometimes full-time educator. So it is really important to know that we are here for you. And the biggest thing I want to say is we can be the aunt or the sister connection to you, just to be a listening ear. We are available under the COVID app, under the Resiliency, under new parents. You don't have to be a new parent to be part of our program. We want to reach out to all parents, really. We service anywhere from pregnancy all the way to anybody that has a child in the home under the age of 4. So if you need us, you call us, because we're here for you.
Good evening, all. My name is Arcelia Aline, Financial Readiness Program Manager, Army Community Service. I'm also an accredited financial counselor, and I'm also the AER officer for USAG Stuttgart. The reason I'm here this evening is to answer any questions you may have related to Army Emergency Relief, AER, or financial readiness when it comes to financial counseling for you and your family during these hard times. So during these trying times, and the world is experiencing the COVID-19 pandemic, saving has become one of the most important things that you can think of besides your health. You know, how can you save? If there's any places you can put your money, or if you don't have any funds, where can you go for financial assistance? I want to let you know that USAG Stuttgart ACS Financial Readiness Program and AER stands ready to provide financial assistance to your families if needed. Now, this, of course, is for qualified personnel. So what we want you to do is to make sure that you call in and find out how you can qualify if your family qualifies. What we're trying to do is to prevent any financial issues that may arise because of the COVID-19 situation. When it comes to AER assistance, we know that active duty personnel, and this would include Army, Air Force, Marines, National Guard, Navy, Coast Guard, so all branches of service can use the AER assistance. Also retirees and survivors can use AER assistance. Now, the issue that we will run into is when we come to civilian personnel, DoD civilians, local nationals. What we would tell those folks to do is to contact your local human resource department. They should be able to have some type of assistance that they can provide to you. And for the folks, DoD civilians, they can use what's called the Federal Employee Education and Assistance Fund. That is the FEEA. And you can find them at www.feea.org. Now, a lot of folks will probably think of and try to find out, what's the process to get AER assistance. Well, if it's not COVID-19 related, you would just contact your local AER officer, which will be us here at Army Community Service in USAG Stuttgart. That's for routine cases. When it comes to COVID-19, then you'll be directed to go through your chain of command, because we want to make sure that your commander and your first sergeant are aware of any health issues that you and your family might be experiencing. Also, since we are providing AER assistance and AER remotely, we have a server. AER headquarters have a server. It's a secure server. It's called the DoD Safe Server, and that's the one that we're going to be using. And the service members will be able to get their funds or the financial assistance via EFTs, electronic fund transfers. You may also ask, how long would it take to get financial assistance? Well, it should take about 24 to 48 hours once AER headquarters receive the requests. AER has over 30 categories of assistance, from basic car repair to even more complicated type of assistance to include travel. So I would ask you, if you have any AER related financial assistance, to please contact us. We are also virtual, okay, so you can locate us at the ACS Facebook, and we provide all the information you need for you and your family members to get immediate financial assistance as needed. All right, thank you.
Hi, good evening. I'm Bill Lovell, U.S. Army Garrison Stuttgart. Many of you know me as the guy who shaved his head about 10 days ago. What you don't know is that was the result of a conversation I had with a chaplain. I'm like you, I had my stress moment, and I went to a chaplain to help talk that out, and they helped me frame and they prayed for me, and that really helped me out, and it got me back in the fight. And so I used my natural defense, which was a sense of humor, and that was a result of that conversation with that chaplain. The reason I'm telling you this is you don't have to go through what you're going through alone. If you don't have a safe person to talk to, we have multiple chaplains that are listed in our in the Stuttgart app that we'd love to contact you up with to talk about what's going on in your life. Also, we have multiple worship services and religious support programs that people are connecting with online, and if you check out the app, we can link you up with those groups, and they would love to include you in their fun and their worship. Thank you for your time.
So, first of all, thanks. Appreciate the brief introduction. If we could now, let's get into some of the questions that have come in.
So, sir, the first question goes to you. Colonel Condrey, how do you stay sane amidst all of this?
That presumes an outcome here. So, sanity's relative. Of course, you get Megan and the kids at home. They're a good part of that. We get a great team here and a sense of humor. That's I think those are the ingredients for me. Been long days and some long nights, and I don't think they're over. But the reality is that equation is probably going to change every day. And so I'll be curious to see how we maintain sanity as a community over the coming weeks and days. It's gonna be difficult, and that's why events like tonight are important, because I think it's important for us to realize that sometimes you got to listen to something other than the voices in your head, and reach out and have a conversation with somebody, make a connection, make sure that social distancing doesn't become social isolation.
The next question is a behavioral health question. Heidi asks, what behavioral health services are available on post, and is the Army Garrison doing anything to assist civilians without TRICARE who require behavioral health care?
Well, thanks for the question, Heidi. I can tell you the amount of services we have is pretty robust. So on the post, specifically in our clinic, as I mentioned earlier, our department is opening, again, their doors on Monday. So most of the routine patient care will be happening over the phone or virtually. Every one of my providers are going to be coming into the clinic one day to see high-risk patients or patients that they really just feel the need to see face-to-face. Our acute services are going to be reopened. So if someone comes in and has thoughts of hurting themselves or someone else, or commanders have a question about a soldier, those services are there. Our front desk number for DSN is 590-1615. The long civilian one, I'm sure you can find on the app. As far as a little expanded, so on the Garrison, MFLAC services are available. They're also providing services virtually as well. Chaplain mentioned that there's a bunch of chaplains out there that are willing to help, and I'm sure they're absolutely willing to. The chaplain just gave me the thumbs up. And besides MFLACs, there's people off post. There's psychologists and psychiatrists on the community that are also willing to help out, and there's multiple ways to access them. If you call our clinic, we have a ready-made packet of resources both on and off post that are there for you. As far as the second part of your question, which is for civilians that don't have TRICARE, I can tell you that there's going to be things that are available because of COVID. So one of the things we're starting to get a lot more influx of is volunteers. I just talked to a potential Red Cross volunteer yesterday that is interested in helping out in the clinic, and there's procedures for getting them credentialed quickly so they can help out. Even Colonel Condrey, when I asked him, said he's going to be able to do things that he wouldn't normally be able to do because of COVID. So in summation, if someone needs help, there's going to be a way that we can take care of you. And if I can't, the chaplain will. If not, Colonel Condrey got my back. So if you need something, all you got to do is ask. We're here.
And along those same lines, someone asked, can the current status of behavioral health services be shared, including medical refills? And can you mention also that there's behavioral health available at schools, having to do with school counselors and psychologists help students and families?
Absolutely. So my department is comprised of really 5 different sections. And I can tell you that for those of you familiar with EDIS and school-based providers, they're still fully functioning. They're not going to be able to do things like they used to be able to do assessments face-to-face, but if you need to reach out to one of those providers, they are available, and they will have telehealth capabilities. So in the schools, or the school-based providers, they absolutely will be available. Behavioral health, as I said, we are reopening our doors on Monday, but our services are going to be reduced. So my hope is, and I'm projecting honestly, for about 2 months, that seems to be a good projection for how long we're going to have to keep this level of service up, is we're going to provide follow-up care, we're going to still take on new patients. It's just going to be a little different than normal, and I think that's just kind of the common place right now, is everything's just a little bit different than normal. But the services are there. So it's going to be telephone-based in the beginning until, like I said earlier, the technology catches up with our willingness, and we will do video over the next 2 months. So more and more of the providers, as they get comfortable with the technology, when the technology doesn't crash on us all the time, that virtual care will definitely be available. And all services, family advocacy, people related to domestic violence and family help, they're still available. Our substance abuse people, they're still available. So there is nothing that is shut down. We are open for business. It's just going to be a little different than normal.
Colonel, the next few questions we have to do with our community mailrooms. I'll read a few of them and you can answer. Cora asks, are you recommending that people only order essential items through the APOs to cut down delays? Natalie asks, is there an updated plan to resolve the CMR boxes overload? And then we've had other people ask about the mailrooms, if it's going to be any change to the red, white, and blue program system that's already in place.
Okay, so some great questions there, and I've gotten probably that series of questions no less than 100 times in the last 3 days since we implemented red, white, and blue. And white and blue realized that there were things probably sitting in the mailroom that they needed today. I know for my family that was birthday presents for our twins' birthday party just 2 days ago. That was changed from a real birthday party to a family party. And so, first of all, the essentials. I don't pretend to know what's essential for you or your family. In my mind, it makes sense that when I asked you to stay home and not expose yourself or your family, that the buy one click option became the way to solve that problem. And so now, the swarm of packages that we saw at Christmas is happening in April. And for those of you that were here at Christmas, I'm pretty sure you can understand why the lines that we had waiting to get packages at the mailroom and the number of people that we had in the back behind the counter working to get those packages in your hand, that's just not possible right now. As I talk to our public health doctors, what we did with 20 people behind the scenes, behind the counter, getting packages ready, I can have 3 people in that same space. And so the mailroom is one thing that if it closes down, we can't go off the installation to get it. We can get gas, we can get groceries, we can go to a pharmacy. Those things we probably could find if we had to close a commissary, had to close the PX again. And as I look at the staff that are running those critical services, those things that I told you I'm going to work to ensure remain open, they're fragile. And what I mean by fragile is they're at 65, 60, high 50%. And one more positive test that takes out 10 people means we close a commissary, means we close a mailroom, maybe 2. And so that's why the measures that are in place with red, white, and blue are in place. They create time. They create space. They create a balance of the load that our community places on those services. And so the problem with additional packages, we're working through it. There's lots of different ideas out there, new places we may be able to give out mail, new methods. And so we're going to start rolling out a couple pilot programs to see what works, see what doesn't work. I want to get your mail into your hands as quickly as possible. I want you to have access to these services whenever you need them. So we're looking at new ways to, whether it's pay online and curbside delivery. I would love to be able to do that with RPX. I'd love to be able to do that with fresh produce. I know the difference between asparagus that you buy in the produce section and asparagus that comes out of a can. I understand those things. I know it's an inconvenience. I need your patience as we deal with these inconveniences and put things in place that give you more access to things that I need you to stay away from. I don't know where the virus is. I don't know if we're bringing it from home. I don't know if we're carrying it. I don't know if people that don't have any symptoms are infecting other people. I just don't know those things yet. We're learning about the virus every day. The measures that we have in place are designed not only to protect us from the virus, but to protect us from what we don't know. And so it's going to take patience. It's going to take bearing some inconvenience. And so thanks in advance for that. And for those of you that are frustrated, I understand. I'm working to fix it. I hope to be able to do so soon.
The next question we have, I believe, is for Lisa. I have a child who is quite anxious about the possibility of both parents getting sick and going to the hospital with COVID-19 at the same time. Has this type of scenario been looked at? And do you have any ideas to help ease her anxiety about this?
Yeah, that's scary, especially depending on how old your child is. That's a very hard question to answer directly because I don't know the age of your child. Because we know, as in child development, talking to a 3-year-old versus talking to an 8-year-old or even a teenager, it's going to look different. I think the best thing you can do is meet your child where they are. Talk to them about their fears. Empathize with them. It is scary. Let them talk it out with you. Listen to them. And then there are a lot of resources that are in the Garrison that have been put on the app under the children. I'm sorry if somebody could help me.
So the Resiliency button, we'll hang some things there about how to talk to your kids. Young kids, teenagers. We got some new materials today. As soon as I can get them home, they'll be there.
Perfect. So you can go there and you can look up, and then if you want one-on-one help, I am a child development and family relations expert. So what we do is we take all of those ideas, all those things that are in print and in books and thrown at you, I put them into a working part of your family. I make it tangible for you. If you tell me this is going on in your world, I'm going to take that formal education and make it real for you. So you can call a new parent support program and we'll help you work through that dialogue. Thank you.
And Lisa, another question from you. This one comes from Mary. And Mary asks, what about some sanity tips for a newbie, someone new to Europe, new to an Army post, an Air Force mom of 4, one is an infant, one a screaming toddler, with essentially a husband trying to unpack 8 million boxes right now?
Yeah, that's a lot. I'm sorry, that's a lot to take on. When I moved to Europe, I felt like my feet weren't on the ground for 6 months, and I moved with 4 children, not an infant and not a screaming toddler, but can I tell you, they have a special place in my heart. I love toddlers. So just do a few things a day, and don't forget to take care of yourself. Do something for yourself every single day as a parent. Walk away from your kids and take turns doing so. And then also give a little bit of time to each individual child while maybe the other parent is unpacking a box. Be kind to yourselves and to your children.
So the next question comes from Kathy. She wants to know, are masks mandatory? And if so, where can we get them?
So, Kathy, first of all, short answer is not yet. Will we get there? Maybe very soon. I know there's some emerging guidance out there, but the reality is we may not have enough to do what we want to do. And so from my perspective, the priority for masks is our medical professionals and our first responders. That may mean that we get really creative as to how we put things that prevent, a sneeze, a cough, somebody that speaks with a little bit too much saliva in their mouth from infecting others. And I don't know what that's going to look like. I'm sure there's lots of creative answers to that. I don't know how we do it. If we're wearing a uniform, there's probably going to be some fairly specific by-service type guidance on that. But the reality is I don't have as many masks as I want to do right now. Right now, we've been telling people that unless you're a medical professional or a first responder, you're wearing a mask because you want to keep other people from getting sick. It makes good sense. I think we need to do that, especially if we realize that people that don't have any symptoms at all are potentially making others sick. So I know that goes along with, hey, we don't know exactly how this virus works yet. And as soon as we know more, we're going to make decisions and expect them to be implemented immediately. And the problem is, none of us have masks at home. None of us are ready to pull those out and put them on right now. And of course, we're looking at what our neighbors outside in the community are doing as well. What's Germany asking of their citizens? What's the state of Baden-Württemberg, the city of Stuttgart, asking of their citizens? And so right now, if you go out in the community, I went out yesterday, you see lots of people wearing masks. It's a, if you have, please do kind of guidance. I think we'll get to that if you can before we get to the you must when it comes to masks, just because we don't have the ability to give them to someone to tell them that they must.
So we have a couple behavioral health questions. Tricia asks, when will behavioral health be taking new intakes, and when does telehealth start? And we've also been asked, do you have any helpful hints for folks who are trying to cope with this?
Absolutely. So, as mentioned, next week is really when we're hitting the ground running. Last 2 weeks have really been the preparatory phase for how to start in this whole new world of telehealth. Well, not whole new world, but one for us. And we're starting Monday. So if you want to initiate care, all you have to do is call our front desk number. Again, DSN 590-1615, and we'll get you locked in. Our schedules are open. We have the ability to book intakes now. When it comes to telehealth, it's kind of the same question, because we're starting next week with really phone calls. We really want to get to the point where we can at least see you, even if it's over an iPad or through a laptop. We really want to get to that point. And honestly, I think most of the providers, they wanted to see you face to face. But really, just for safety reasons, we can't do that right now. So all that stuff is really starting Monday. So please give us a call if you'd like to initiate care. The second part of the question was about helpful hints on how to combat isolation or just feeling alone. And let's use some notes, if I don't mind. So one of the things that I think is probably the most important thing, and one of the things I taught the students at the SEER school, was even in extreme isolation, developing a routine is important. I know for me, when I was starting quarantine, I didn't have that. I was so used to my normal routine of going to work that I just felt really thrown off, and I didn't really have my feet under me. So I had to develop for the last 2 weeks my own routine and how to work from home, my staff meetings, doing all those types of different things. And that routine really helped calm me, reduce some of my stress, and reduce some of my anxiety. So plan daily activities that make your life a little more predictable, and same thing for your children. It definitely helps. There's a ton of social media resources out there, Facebook or WhatsApp. If you're looking to exercise, you may not have a home gym, but there's a great many resources out there for body weight exercises that I can recommend. Facebook groups. I think a lot of groups are getting started now with like crafting and meditation. You can watch people at home play live stream. I think I saw something on the Garrison Facebook page of a lady singing opera off a balcony. Just watch her, I guess. Another thing, nomenclature matters. So the words you use really matter. I think everyone right now is using social distancing. I listened to a podcast, and I love to say who it was, but they changed it. They said, why don't we use the word physical distancing? Because that's really what it is. We're trying to protect ourselves from the virus, not each other. So think of it like physical distancing, not social. You can still keep in touch. There's ways where you can do group chats, still get to know people. Those resources are there. Something to think about too is, I know with my busy life, I forget about people that I haven't talked to in 5 or 10 years. Those old college or high school buddies that I haven't reached out to for a very long time, or that aunt that I haven't reached out to. This is a great opportunity, if you have that extra time, to maybe FaceTime with that person you haven't talked to in a while. That's one way to do it. And Chaplain mentioned humor, changing your mindset and changing your expectations. If you think this is going to be over in a week or two, then your expectations are probably a little off. If you can project out maybe another month or 2 or 3 that you're gonna have to figure this out, managing your own expectations, changing your mindset, it's a huge deal. Find humor in little things, and remember that how you think really dictates how you feel. And the last one that I have really goes to communication. Just because you're so engrossed with the person in your house that you feel like you guys are communicating too much, sometimes you may not be communicating about the right things. So if you just need 5-10 minutes away from your husband or wife or the kids, just ask for it. Don't assume people can read your mind. I promise you they can't. So even though it feels like you're probably talking to people too much, it's okay to communicate your needs. So those are just some helpful hints that my team and I put together for everyone here, and I hope that you can find some use in those.
Colonel, we have a question about, actually, that came from one of the screeners who's working right now outside one of our facilities,
Okay.
asking folks to wash hands prior to entering. For the most part, people are wonderful about it. However, we've had a few that have refused. What is your policy on hand washing prior to entering the facility? Mandatory or just a suggestion?
That's pretty simple. I put hand washing and having clean hands to go into one of those critical facilities in the same category as paying for the things before you leave. So just as I suspend access to the PX and commissary for those that shoplift, if you don't think you need to wash your hands, I have a solution for that problem.
Colonel Sylvia asks, for those who are at high risk with having underlying health issues, should we physically report to work if we're non-essential employees?
You know, I know that's an ongoing discussion, and the tough part is identifying who is high risk. It comes back to trying to understand how this virus works. First of all, I think that's a conversation that starts with your doctor and then moves to your supervisor next. And I realize that may be difficult, and I don't think there's too many supervisors out there that if after you've had a conversation with your doctor, even if you are mission critical, will say, no, you must come in, you must put yourself at risk. There are ways that you can come in and work, and we can sanitize an area that minimizes that risk. And so there's lots of different pieces that go into that discussion, but it starts with a conversation with your doctor. It then moves to a conversation with your supervisor and seeing if you can find a way to do the things that you do from home. And not on this installation, that's not possible for every job, and I get that. But have that conversation. Start from a position of knowledge after a conversation with your doctor, and then have an honest conversation with your supervisor. That's going to be difficult because that's going to require you to give some information that you generally wouldn't give. But in this day and age, that may be the difference between you being in a position where you get sick and potentially hospitalized. And this virus takes advantage of those of us that are in the highest risk area.
So we have a question now that is actually for the chaplain. Chaplain, there's a lot of people who are concerned because we have a very important holiday coming up. Is there anything you can tell us about celebrating Easter during the time of COVID?
First of all, I would say most of our services have set something up to do virtual mass or virtual worship services on Easter Sunday. That is a way to connect in with that. Also, for our Jewish military community, hi Erica, Larry, and Nama. I know this wasn't the Seder you planned on, but there are online opportunities that are going on for the various religions that are going, the various religious needs that are going on. I would say it is effectually we cannot, because of the COVID virus, open up our chapel buildings even under the circumstances. But please don't use that as an excuse not to connect with our worship services, because we are going to celebrate Easter. We are going to celebrate the resurrection. Thank you.
And we're winding down, sir. We have our last question, and it's actually about commissaries and some policy things.
Okay.
Would it be safer to just shut the commissary and do pickup orders only? And along those same lines, we also had someone ask if we have places that have multiple doors that require everyone to enter and exit through the same door, wouldn't it be better for social distancing or make sense to have one entrance and one exit?
Yeah, I realize that that the single entry exit is complicated depending on what building you're talking about. The reality is, I don't have a lot of people to guard doors, and I need somebody in a position where they can hopefully find somebody that's sick before they get inside. But now we're talking about how many people should be in, whether or not they have a cart. And so that means that as you come out, somebody else can come in. And so that's kind of a one-stop shop, especially for some of our smaller areas where, like our expresses, we don't want more than 10 people in at a time. And so if somebody's going out the opposite door, don't necessarily know when the next person should be able to go in. And so I'm mindful of that. There may be a better way to do it, and if we figure a better way out that prevents somebody from having to wait outside for somebody to come out before they can go in, then maybe we can implement that. With respect to shutting down completely, I think we are leaping ahead in terms of the way that we buy things. And I would love to be able to implement everything as a curbside delivery once you've placed an order, but we're just not there yet. And so we're going to try. We're going to as quickly as we can. I know there was a pilot program that AFI's initiated in Aviano with some purchase online, and it'll be brought to your car. The reality is, until those people that do that in our exchange are healthy and back at work, we're not going to be able to do that. It's not as simple as somebody like me being able to carry something heavy out to the car. We've got to have the right people that are pulling things from the stocks, filling that order, running the payment method, and then somebody like me potentially could volunteer and bring that out to a car. So that's coming soon. It's not going to be as soon as I would like it, but it's coming soon. And hopefully we can replicate that in the commissary. I know that we have now found a way that for somebody that's shopping, for somebody in isolation or quarantine, that a phone call will allow you to make payments. So we're not having to give away, try and give cash or give a credit card under the door in order to allow somebody to pay for groceries. And so we're learning how to do this better each and every day. And as we make progress, I'm going to tell you about it. We'll do a video, we'll do a message, we'll do something so that everybody knows that it's happening, because I know the community's paying attention. You're eager to find out how we're going to do this better, and we're working hard to do it better each and every day. Is there another question, Rick?
There's 2 questions left,
Okay.
Colonel. Mary asks, I'm set to go home in May. Is there any likelihood I can stay? And do you know if the Red Cross is able to get folks home if they're dying family members?
Yeah, Mary, those are great questions. And in terms of timeline, I will tell you that my crystal ball is no better than yours. I'm hopeful. I'm planning for it not to be possible, because I think that's what you pay me to do. But in terms of some of those emergency circumstances where we've got family in need back in the States, I know we're working through the approvals and getting the transportation resources together as quickly as we can to deal with things just like that. And so as that process unfolds, what I will tell you is voice those concerns through your chain of command. Voice them to me in every direction. Ask, and we will find a way to try and get to a solution that works for you, works for your family. And so, one more question. We have one more?
We have one more, sir.
Okay.
This is about future videos in town halls. Is it possible to have a head psychiatrist or a person in mental health do more video posts and bring them on for these special town halls?
So I think a lot of the things that you've seen us do is based upon sort of the crowdsourcing of ideas and things that this community wants or needs. And so as you see that stuff, the Garrison assistance team, that email, that is the one place that I'm asking you to send those things. I'll get them out to all the peoples that own those resources, all the experts out there, and we'll figure out how to meet that community need. A couple thoughts as we close. So, I'm asking you to take a look at the app. Under the Resiliency button, we've put all the things that we've talked about tonight and many, many more. We're trying to adapt the things that we used to do to the problem set we have today. And so take a look at that. If you see a gap, let us know. I want to continue to meet the needs, to help this community understand exactly how to deal with this problem and deal with this problem together. I'm asking you to help me keep up the fight against COVID and complacency. Those are our adversaries right now. And I can't do that alone. I'm going to put some measures in place. I'm going to keep them in place. It's going to be inconvenient. I'm not going to take pleasure in that inconvenience, and I'm going to work hard to make sure that we can minimize those. But there's still going to be inconvenience. And I need you to make the effort. We need to find people that are in crisis before the crisis. I can't do that. We as individuals might not be able to do that. I'm pretty sure that together we can do that. And so I want to say thanks to the people that joined me tonight, the experts in the room, the ones that are, answering questions on the live stream here. I want to say thanks to them as well. Before school started, I asked all the teachers, I asked them to be our sensors, to look at each and every one of our kids each and every day and try and figure out if something was wrong, if we needed to intervene in advance. I'm concerned that we just started spring break, and that first line of defense, those teachers, they're not part of our solution right now. And so everybody else, you need to double down. You need to look within, you need to look around, and you need to look for that person that needs assistance. And if you can't provide that assistance, find somebody that can. So I appreciate the questions tonight. I appreciate the great answers that came from this group here tonight. I appreciate the ideas that every one of your Facebook posts, every one of your emails, they cause us to think. Those are great ideas. They allow us to be better. Every day is COVID day until it's not. And I am focused on this community setting the terms for how we fight. So thanks. Have a good night. For those of you that didn't catch this video, we'll have it posted. You can go back and look for it. All the resources that you want and need, if you don't see them on that button, ask. We'll get them there. Thanks and have a good night.